The brachioradialis muscle starts from the distal end of the brachium and then comes down to the distal end of the radius bone, all throughout here. So when pronated, the two most visible projections are the head of the ulna and the head of the radius. The head of the ulna is very easy to palpate, it sticks out, and then when you move just a little bit distally, you'll feel a gap, and that would be the ulnar styloid process. Right across from that, you'll feel the head of the radius, and if you move a little bit distally, you'll feel a gap, and that would be the radial styloid process. So the styloid processes of the radius and the ulna are important for maintaining strength and flexibility of your wrist and your forearm. In order to see the anatomical snuff box, you'd ask the person to stick out their thumb, and you'll see the extensor pollicis longus tendon and the extensor pollicis brevis tendon, and right underneath would be the abductor pollicis longus tendon. In the anatomical snuff box, the scaphoid and the trapezium bones are palpable. So right in here would be the scaphoid, and the scaphoid is the main weight-bearing bone of the wrist, so it commonly gets fractured. When the hand is in a fist, you can feel the flexor carpi radialis tendon, the palmaris longus tendon, and the flexor carpi ulnaris tendon. Lateral to the flexor carpi radialis tendon is the radial artery. And here, above the radial artery, you can feel the radial artery pulse. Here you can see the wrist crease, and all the carpal bones are distal to that wrist crease. The first projection you feel distal to the wrist crease would be the scaphoid, and above that would be the trapezium. The first projection you'd feel is the pisiform, and above that is the hamate. In between these carpal bones is the carpal tunnel, and within the carpal tunnel run 4 tendons of the flexor digitorum superficialis, 4 flexor digitorum profundus tendons, and 1 flexor pollicis longus tendon.